Okay, so now is the time for the letter C. C represent for cartilage, which means that we have to access all kind of cartilage in in the knee. Normally, we have two main kind of cartilage in the knee. The first one is the fibrous cartilage, which has the fibrous content in which is integrated into the structure of the cartilage. Uh, be, because normally the signal of the fibrous component will be in hypo signal in all of the MRI sequences. So because of that, this kind of uh, cartilage tend to be hyposignal in all sequence also. In this case, you can see that we have two very small, tie-like shape appearance which present in uh, the 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 medial aspect of the tibial tibial femoral joint and the lateral aspect of tibial femoral joint, which represent meniscus for the meniscus. Normally, it will present at a two lateral tie-shaped appearance, which presents at right in which uh, aligns with the light of the medial and lateral aspect of the tibial femoral joint. If if this kind of structure is somehow dislocated from its own structure, or it changed the signal from very hypo signal in all sequences, especially uh, on the PD facade sequences, you have to think about an abnormal situation. One of the most common situation that you frequently encounter in your radiologist career, which is osteoarthritis. In case the osteoarthritis, this kind of medial uh, tibial femoral joint will be narrowed uh, as severe as it can somehow it can somehow damage the posterior root of the medial meniscus and which dislodge or dislocate the body of medial meniscus out of the normal uh, tibial femoral joint. Uh, in that situation, you will see that uh, it's small the small body of the medial meniscus will cannot be aligned with the normal medial aspect of the tibial femoral joint. Um, the other in other cases, you can also see some kind of change in the signal of this kind um, of um, of cartilage. Um, the two most common uh, the two most common pathologies that uh, you almost always uh, have in your career, which is degeneration and tear. Both of the both of these disease will cause a hypersignal lesion or light in the body, the anterior horn or posterior horn of the meniscus. But the key here, the key different, the key idea which will uh, drive our diagnosis to work degeneration or tear, which is the which is comparing the abnormal signal with the normal signal of the fluid in the knee joint. If this kind of signal, if this kind of hyper signal is iso signal with the knee or the fluid joint, which means the fluid has been leaked uh, or extend into the structure of the meniscus. That means this is a reality. This is a real tear line of the joint of the meniscus, and at that time you have to classify that kind of tear into whether it is grade 1, grade 2, or grade 3, or grade 4. You don't need to care much about grade 0 and grade 4 because it's quite obvious. The most common uh, situation or context that you tend to beat um, dif- beat different tend to distinguish between is the grade 2 and grade 3, while the grade 2 is a intra meniscal tear which do not directly connect with the knee joint. The grade 3s have a tear which can directly see the connection between its own cartilage and the knee joint. And so why do this differentiation is so important in case of treatment planning? Because in the context of grade 2 meniscal tear, the most usual treatment plan will be conservative treatment, while the surgeon will consider surgery repair in case of grade 3. Um, so, on the other hand, if the um, hypersignal light in the meniscus um, is not iso signal with the fluid joint, which means that it is hypersignal but not as bright as the signal of the fluid in the knee joint. Uh, that refers to a case of degeneration rather than a case of meniscal tear. Uh, yeah, that's the case. Besides the two aforementioned uh, common disease that uh, we have mentioned previously, the third one will also need to be considered when you interpret a case of knee MRI, which is crystal deposition disease. Normally, we have three kind of crystal deposition disease. The first one is gout, which tend to present at the fibrous cartilage, like in this case. The other is pseudo gout or CPPD deposition, which tend to present at the hyaline cartilage at the surface of knee joint rather than the fibrous cartilage at the corner of the knee joint. And the last one is BSP, which normally present with the calcification deposit into the tendon structure, like the supraspinatus tendon, for example. Yeah, okay, that's all about the meniscus. The meniscus. Let's move on to the second type of cartilage in the knee joint, which is hyaline cartilage or surface cartilage of the knee joint. Normally, in order to prevent the the